Okay, let's go ahead and get started with our afternoon. We had a packed morning with a lot of good presentations. I thought the questions from the audience were outstanding, so thanks for the audience participation part, because we can't bring that, you bring that, so thank you for that. So we've got, I think, a very informative afternoon, and this is our survivorship part of the day. We're going to start off with the other half/leader of the Integrative Medicine Group. You heard Kathy Sanders speak, I believe, last year, for those of you who were here. Kathy is part of the team brought by Dr. Greenlee from Columbia to come out to Seattle a year and a half ago?
2 years ago.
2 years ago. Mm-hmm. And Dr. Greenlee is the medical director of the Integrative Medicine at the Scca, and brings science to integrative medicine, complementary health, and others in a way that I think perfectly fits our patient population. And we're delighted she's going to talk to us. Dr. Greenlee.
Okay, thank you. All right, well, good afternoon. Thank you so much for being here on a Saturday. I'm really excited to get to talk with you and share with you some of the recommendations that we have for cancer survivors specifically related to integrative medicine. And I will talk about what that means exactly. So integrative medicine is we talk about it as the things that patients can do beyond their conventional treatment. What we're interested in doing is answering the questions that patients have when they come into our offices, saying, well, okay, what can I do besides receive state-of-the-art cancer treatment? What can I do on my own? So patients often have questions about dietary supplements, about yoga, about meditation, about acupuncture, about physical activity, about diet. And so we in our program at Scca, we address all of these factors with patients. And we have a clinical program in addition to a research focus as well. So I'm just going to put a quick plug for some information that's out on the table out front. Here's a flyer that talks about our integrative medicine program at Scca. If you're a patient and you're interested, or you know somebody who might be interested in attending, there's some information on the front on how to make an appointment with us. And I'm going to talk about acupuncture a little bit today. And we also have a flyer out about how to find an acupuncturist in your community, because a lot of people might be interested in acupuncture, but they don't know how to actually go about and find somebody who's appropriately qualified. So last year, Kathy was here, and I think she gave a general overview of our program. We currently have 4 clinicians. I see patients as a naturopathic physician. Kathy Sanders is a nurse practitioner. She's been practicing for over 35 years, and about 10 years ago, she started focusing on mind-body medicine. And so in mind-body medicine, she works a lot with patients on mindfulness-based stress reduction, guided imagery, progressive muscle relaxation. She's really gifted in these areas. And then we also have 2 acupuncturists. And one of them, Kathy came from Columbia with me, as Dr. Bird noted. We brought one of our acupuncturists from Memorial Sloan Kettering in New York, where he was part of a large acupuncture program there. And then we brought our other acupuncturist, from Cleveland Clinic. She just joined us this summer. And so we brought in clinicians who are really highly experienced in both the clinical setting and also the research setting, because we know that what I'm going to talk about today is sort of what do we know and what don't we know related to integrative medicine in the oncology setting. So we have a lot of research that we need to do. So I'm going to start out by talking with you about clinical practice guidelines that we published recently on the use of integrative therapies during and after breast cancer treatment. And you might be asking, well, why on earth? This is a melanoma survivorship conference. Why are we talking about breast cancer? It's because the integrative medicine field is still really growing, and we don't have a lot of good data to guide us specific to melanoma patients, but a lot of the data that we have in other areas, especially in breast cancer, can apply to melanoma patients, because a lot of it has to do with symptom management. And so I'm going to review the state of the science with you today about what we know specific to some of these therapies, and I think we can easily apply what we know in breast cancer to melanoma as well. So these are guidelines that we published out of the Society for Integrative Oncology. This is a society that's been around now for almost 15 years, and we produce 3 different things in this society. We produce an annual conference, and so this is actually going to be in New York City this October, and there's a really great patient advocate cancer survivor part of that conference. So if anybody's interested, I highly recommend that you go check out that conference. I'm not sure where the conference will be next year, but this year I know they have a patient advocate panel, and they have some scholarships that they've offered some folks. So we have an annual conference. So we have a website where we have a lot of information for patients and clinicians on the latest information on integrative oncology. And then we also publish clinical practice guidelines. And so I've been very involved on the clinical practice guideline front. So what exactly are clinical practice guidelines? Well, these are guidelines that we push out into the world to inform both clinicians and patients on really what's the state of the science out there when it comes to whatever the clinical question is. So in oncology, there are numerous clinical practice guidelines on what's the state of the science for specific oncology treatments. And we thought it was really important to start pushing these out specific for integrative oncology as well. And so we really thought that we hit, we achieved what we wanted to do when Time and Consumer Reports picked us up, because what that told us is that our information isn't just being buried in medical journals someplace, but it's actually getting out to the public, to places and to people who we want to reach. So what happened last summer is that in 2018 is that ASCO, the American Society for Clinical Oncology, actually endorsed our guidelines out of the Society for Integrative Oncology, which is terrific. Which this means that they put their extra stamp of approval on the work that we've done, and that just further validates the work that we're doing and the findings that I'm going to share with you now. So what do we know? What therapies can we recommend to patients? So this is a slide that just summarizes, and if you want, these guidelines can be found online. I don't know if the website is here on top. If you just go to the Integrative Oncology or Society for Integrative Oncology website, you can find all of these there. But this is what we recommend. And so for these are the therapies where we have high certainty based on the clinical trial evidence that the net benefit is substantial or moderate to substantial. And so here for anxiety and stress, which we know a lot of cancer survivors encounter, we know that meditation, yoga, stress management, and music therapy can all be really useful in those settings. We know for depression and mood, again, this affects a lot of cancer survivors, meditation, relaxation therapies, massage, music therapy, and yoga. For chemotherapy-induced nausea and vomiting, which affects some cancer survivors depending on their treatment, acupuncture and electroacupuncture have been shown to be incredibly effective. And then for quality of life, meditation and yoga, we have really strong data suggesting that both of those. Now what you'll see here is that we don't have any dietary supplements. And in our clinic, most patients come in, sometimes with 1 or 2 supplements, but sometimes with lists of 25 supplements of the supplements that they're taking, saying, well, we really want tell me, are these the supplements that are going to help either help improve my prognosis or help prevent my cancer from coming back or help improve my symptoms? And we simply just don't have data at this point supporting the use. And I'm going to talk about that a little bit later. But what we do here is we have really, really strong evidence suggesting that many of these different mind-body therapies, and we call them body-based therapies like acupuncture, can be really effective at managing symptoms that patients are facing. And so this is a lot of what we offer here in our program. Now, in terms of our therapies to consider, this is where we have moderate certainty that the net benefit is at least small. So this is where we often have small pilot studies that show that there might be some potential benefit going forward, but we haven't yet conducted the definitive trial. And so for anxiety and stress, we have a growing body of data showing that acupuncture can be really useful. And so this is a nice alternative for people who aren't interested in taking pharmacologic agents if they have an anxiety disorder. Massage and relaxation are also useful. For depression and mood, again, acupuncture, healing touch, which is often implemented by nurses, and stress management are useful. For chemotherapy-induced nausea and vomiting, we have ginger. So this is the first dietary supplement that we've seen. And this can be in the form of either a concentrated ginger capsule or a tea, and then also relaxation therapy. There's a growing body of evidence that used in conjunction with conventional antiemetics or anti-nausea meds can be useful. And then for quality of life, we have a really strong growing list here. Acupuncture, subcutaneous mistletoe, we'll talk about that in a minute, Qigong, reflexology, and stress management. The subcutaneous mistletoe, that definitely applies to breast cancer, so that doesn't apply to this audience. But all of these other areas, these are all things that can be applied really across the board to all cancer survivors. Now, this is an additional list of therapies to consider where we have a growing body of evidence. For fatigue, many patients face fatigue due to their treatment, sometimes due to their cancer. Acupuncture, yoga, here American ginseng, which is another herb, and hypnosis can be useful. For pain, acupuncture, we really have across the board in the acupuncture literature, not just in oncology, acupuncture can be incredibly effective for pain. Massage, healing touch, music therapy, and hypnosis. Sleep, gentle yoga can be really helpful for sleep. And lymphedema, we have some manual therapies, laser therapy and manual lymphatic drainage. And again, so you can see here that in the large body of literature that's now out there on these therapies, we really have a lot of information showing that the mind-body therapies, acupuncture, massage, those can be very effective. We have very, very few dietary supplements that have shown to be effective and safe in this particular setting. Now, unfortunately, we also have studies showing that either therapies are not effective at all or that some of them are harmful. And so I just want to talk, this is really more in the setting of breast cancer, but I'm going to talk about this a little bit later on specific to melanoma. I want to just plant the seed that just because something is a natural substance or does not mean that it is safe or effective. So for fatigue and breast cancer, we've shown that acetyl L-carnitine and guarana, which are two dietary supplements that you can get at some grocery stores, some gas stations, and some energy drinks, that we do not have data suggesting that these are effective. Yet these are commonly on the market. They're marketed as being effective, and they're not. So I think it's really important when you're thinking about taking dietary supplements to make sure that you understand the science behind what the recommendation is. A lot of women use soy for hot flashes. At this point, we don't have effective data showing that soy is effective, and there are some concerns sometimes with the use of soy for acute radiation skin reaction. People for good reason, people want to be able to put things on topically on their skin. We don't have data suggesting that either aloe vera or hyaluronic acid cream are effective for that. Glutamine, again, is something that's very commonly used with the hope that it's going to help with nausea and vomiting, but the trials just haven't panned out. And then neuropathy, this is for one of the taxane drugs that breast cancer patients take. We actually conducted this study. Unfortunately, we found that acetyl L-carnitine made it worse, made the neuropathy for patients worse. And the reason that we tested this particular supplement is that there is really strong data in the HIV neuropathy literature as well as in the diabetes neuropathy literature suggesting that acetyl L-carnitine, or showing that acetyl L-carnitine is very effective for those specific types of neuropathy. So we wanted to test it in the breast cancer setting. We conducted a large-scale multi-site trial, and as I said, we found out that the dietary supplement made things worse. And so again, we're very cautious on the dietary supplement piece. And I say this as a naturopath. I started my career thinking that I was going to really start doing most of my research in the area of dietary supplements, and I started doing that research. And trial after trial, our studies just weren't coming out positive, but where we were starting to see benefit was more in the lifestyle and behavioral interventions, diet, physical activity, and weight management. So over the course of time, I've shifted the focus of my research program and our clinical program so that we can really focus on the therapies that we think are going to be the most helpful for patients. So specific to clinical practice guidelines, we now have a body of evidence that supports the routine use of selected integrative therapies in the oncology setting, which is why the SCCA brought me here to launch our integrative medicine program, which I'm thrilled to be a part of. We always have the need to balance the benefits and risks of any therapy, and so this is something that we talk to our patients about when they're thinking about using these different integrative modalities. The risk of meditation is fairly low. The risk of yoga practice, if you're not doing it right, you can injure yourself, but the risk is fairly low. Whereas, the risks of taking, high-dose dietary supplements on a regular basis, those risks can be much higher. So this is something that we just have to account and think about when we're all making decisions. We think that clinical practice guidelines, or we know that they provide an aid to making complex clinical decisions for both patients and for providers. So we want to, as I said, we want to get this information out into the hands of people who can use it. Specifically for clinical practices regarding complementary and alternative medicine use, We think that this use needs to be discussed upfront and monitored over time. So we're trying to talk to all of our clinicians at SCCA. If they don't have time to talk to their patients about it, send them to us because we want to talk to their patients about what they're using. And then it needs to be more than a one-time discussion. And so if patients are coming in, or if you're talking to your clinicians during, right at the time of diagnosis, what you're interested in using and what might be appropriate for use is going to be different than what's going to be used during treatment and different than use during survivorship as well. And so I think it's really important to have continued and ongoing discussions. And we think that it's very important that patients need to be advised about the evidence for and against the use of different therapies. And again, we think that guidelines improve the ability for both patients and clinicians to make important healthcare decisions. So now I want to change gears just a little bit and talk about, well, what do we recommend? So they talked a lot, so we talk about mind-body therapies, we talk about body-based therapies, but where are we really spending most of our time? And so this really is where I'm spending most of my research time and actually most of my clinical time with patients these days. And so this really looks at cancer prevention recommendations. These are put forward by the American Institute for Cancer Research, which is an organization that works in concert with the World Cancer Research Fund. And they put out recommendations for cancer survivors, or for prevention, but what they really do also say after cancer diagnosis, follow all of these recommendations here. And so I'm just going to walk you through these generally and then go into some more depth about what the specific recommendations are. And so the first is, the very first is to not smoke and avoid other exposure to tobacco and excess sun. So those are all, we know those are very important in reducing cancer risk. If we start at the bottom left, be a healthy weight, and so either maintain a healthy weight or establish a healthy weight and maintain that over time. Be physically active. If there's one thing that we would like all of our patients to do, and all of our clinicians and all of our staff to do, is to be physically active. We think that this is really one of the most important things that any of us can do for our health. Eat a diet rich in whole grains, vegetables, fruit, and beans. Limit consumption of fast foods and other processed foods high in fat, starches, or sugars. Limit consumption of red and processed meat. Limit consumption of sugar-sweetened drinks. Limit alcohol consumption. Do not use supplements for cancer prevention because we don't have data suggesting that they're effective at this point. And for moms, breastfeed if you can. So now I'm going to now I'm going to go into each of these in detail, but I really like this graphic because it just summarizes everything, I think, in a really visually appealing and efficient way. So first of all, avoiding tobacco. There is absolutely no safe way to use tobacco. We all know this, but I think it's important to say. And it turns out that vaping is turning out to be not safe either, as most of you have probably been reading some of the headlines about that recently. So we know that cigarettes, cigars, pipes, spit, and all types of smokeless tobacco all cause cancer. And one of the things that we do, we run a lot of trials related to diet and physical activity and weight management. And when our patients are being screened to participate in our trials, we ask everybody if they are smoking. And if they are smoking, we say, thank you so much for your interest in your trial. You're not eligible to participate because we think it's much more important for you to stop smoking, and we refer them to quit lines, and we refer them to clinicians who can help with them with that, because we think the overall effect on their health is going to be much more beneficial if they stop smoking. And so there's some really great free resources in Washington State, so those are listed here. And one of our investigators here, Jonathan Bricker, has been doing some really wonderful work with apps, mobile apps, on support for smokers to quit smoking. So if anybody's interested in any of that, let us know. But there's some really great statewide resources. So I think everybody here understands this about decreasing sun exposure. But just to reiterate, using sunscreen as part of a daily skincare protection plan is really important. There are a lot of new products out there on the market that can make it easier for people to use, and there are a lot of options. It's important to use sunscreens with broad spectrum protection, both UVA and UVB rays, and with high SPFs. And we want to obviously decrease the use of tanning beds as well. So for this, achieving and maintaining a healthy weight, people often want to know really what this means for them. And so the first thing to do is to consult with a healthcare provider to figure out what's the most important for you. But it's important to point out that people who are overweight or obese are at high risk not only for developing specific cancers, but also for high blood pressure, high cholesterol, diabetes, heart disease, and stroke. A lot of the work that I do is in the area of breast cancer, and more breast cancer patients actually die of cardiovascular disease than they do of breast cancer. And so this is something that we want to talk to our patients about so that they can make sure to reduce their risks across multiple comorbidities, not just their specific cancer. And one of the things that we know is that for people who are overweight or obese, even a small amount of weight loss can have beneficial effects over one's lifetime. And it's because this lowers the risk of several diseases. And so the American Cancer Society and the American Institute for Cancer Research have slightly different recommendations for weight, and so I'm going to talk about those just so that you can understand those. So this is a graphic that shows the curves of body mass index. Body mass index is a ratio of height to weight, measured in meters and kilograms. And so what we consider to be a normal body mass index is somewhere between 18.5 and 24.9 kilograms per meter squared. And there are BMI calculators online that you can find very easily that can help you calculate what your BMI is. And so the ACS has a broad range between 18.5 and 24.9. The American Institute for Cancer Research has a slightly more stringent recommendation, and they say be as lean as possible without being underweight. And what their recommendation is to be more around 18.5 to about 23 or so for your BMI. Now, what's interesting here is that there's actually controversy, there's a lot of controversy about what the recommendation should be and whether or not everybody should be at that lower end of the spectrum. And actually we have some data that's really showing us that it might be better for cancer survivors to be at the higher end of the spectrum, more between 23 and 25. And so this is an active area of research we're really trying to understand. I mean, some of it is that we're also trying to understand how different cancer treatments behave in the body depending on somebody's body mass index. And it's really how much adipose tissue somebody has and also the amount of lean muscle mass. So this is an active area of research here at Fred Hutch and at Scca. So this part, eating a healthy plant-based diet. So you can see a plate here. Ideally, we want half of a plate to be filled with fruits and vegetables, and preferably dark leafy green vegetables. The recommendation is to eat 5 to 9 servings of fruits and vegetables a day. A serving is about a half a cup or so, or if you take your hands together and cup them like this. It depends if it's cooked greens versus loose lettuce, but that's about what it is. And the goal is to have at least half of the plate filled with vegetables. And it's really important to focus on cruciferous vegetables. So these are things like broccoli, cauliflower, kale, Brussels sprouts. These all have really wonderful cancer protective properties in them. We think it's important to eat a diet that has a lot of healthy fats, olive oil, nuts, and seeds. You might have heard about the Mediterranean diet. This is a dietary pattern that people in the Mediterranean eat, and it's been really one of the most thoroughly studied dietary patterns that have shown the largest benefits across multiple health outcomes. And so there's a ton of information online about what that really is, but it's something that's high in fat, high in lean meats, low in processed foods, and high in vegetables. And then we focus on lean meats, chicken and fish, as opposed to things like beef and pork. And the reason for that is the amount of saturated fat that tends to be in the foods. And we think it's really important for people to eat protein, but we don't want the protein to be loaded with saturated fats as well. So we spend a lot of time with our patients focusing on how do we actually behaviorally go through and increase fruits and vegetables in somebody's diet. So one of the ways that we do that is through some online information. And so there's a previously an organization called Cook for Your Life. It's based in New York City, and it was founded by Ann Ogden Gaffney, who you can see here. Ann is a 3-time cancer survivor, breast, kidney, and now renal bladder cancer. And Ann she's been a friend and colleague of mine for about the past 10 years, and she founded this organization called Cook for Your Life after she'd gone through cancer treatment for the 2nd time and found that nobody was talking to her about food. She grew up with food, she loved food, her taste buds were changing during treatment, and she was trying to understand, well, what resources can we get into the hands of the people who need it as they're going through treatment. So she left her fancy job in the New York fashion industry and founded this organization called Cook for Your Life. And what she did is that she started just teaching cancer patients and cancer survivors in different New York City hospitals and cancer organizations how to cook. And so she would have cooking classes, and she would try to teach them how to cook healthy food or how to cook food that they would want to eat during treatment, or they'd work with the caregivers on how to prepare food during treatment. And I met her when she was, in this phase, creating these classes. Is, well, what you're doing is really interesting, but how do you know if it works? Because we don't want to just change people's behavior for a week. For cancer prevention and improving cancer survivorship, we want to be able to change people's behavior for multiple years so that they can really have the benefits of eating a healthy diet. So that led Ann and I to writing a few grants, which were funded. And so since 2009, she served over 12,000 individuals. And in about 2012, I think it was, she decided that in order to reach even more people, she wanted to create a website. So she launched a website, cookforyourlife.org, which now has over 1,100 recipes and I think 300 cooking videos, and has a lot of information on healthy cooking for cancer survivors. The website has traffic up to 250,000 people per month. There's over 5 million individual people who've gone onto the website. The website is in English and Spanish. And so we have a reach, we have a lot of followers in Argentina and also in Chile and in the UK. There's a large following there in addition to the United States. So when I was meeting with Ann in New York last summer, when we have an ongoing study using the website, she told me she was going to retire. And I said, what? You can't do this. But she's going to retire. And so she said that, she was trying to figure out what to do with her website. So I said, well, don't do anything yet. Let me go back and talk to the folks here at Fred Hutch and see if there's, possibly a new partnership that we could develop. And long story short, in July of this year, the Hutch acquired the website. We're taking it over for Ann, and we're in the process of building up even further. We're going to create a research component to it where we can collect some data on the back end. It'll all be, people will opt into allowing us to collect the data. But what we're really interested in knowing is this a resource that can be effective at helping people create these long-term behavior changes regarding their diet and how to cook. So we're really excited about this. And so we now have a couple of grants funded that we're going to start using to test. And actually towards this too, and towards some of the work that Ann and I have done together, we recently just got a grant funded to create a teaching kitchen here at Fred Hutch as well. And so we're going to start working on that in January. So we are excited to get this work going. So eat your vegetables and go to the website and check out how to make, the recipes are delicious and they're easy to cook. We don't promote really fancy, hard to find ingredients, and they're really accessible. So give us feedback. Let us know what you like. So physical activity. So in addition to eating your vegetables, please be physically active. Our target for everybody is at least 10,000 steps a day, but that doesn't always get people's heart rate up. And so what we really want is people to engage in 150 minutes of moderate to vigorous physical activity per week. And so this is where you're getting your heart rate up to the point where you're feeling a little out of breath and developing a sweat. And this is something to do weekly for eternity. And some people like to exercise alone. Some people like to exercise groups. There are a lot of options here in Seattle about how to get involved. It's great to be in the Pacific Northwest. And the trick is to find just something that you love doing. It doesn't really matter what it is. It's just something that you really enjoy doing that gets you out and moving. So I can't say more about the benefits of that. Now this one for some people is a little bit difficult to embrace, but this is really important too. And I think there's a lot of clinicians don't want to talk about alcohol consumption with their patients, but I think it's really important. So if consumed at all, men need to limit alcoholic drinks to 2 servings a day, and women, just the way that our body metabolizes alcohol, we need to limit it to half to 1 serving a day. And actually the American Cancer Society, as I've heard, is probably coming out with even more stringent recommendations, which is 1 to 2 drinks per week or not drinking at all. And the reason for that is that because some of the alcohol metabolites can be pro-carcinogenic, and it can be problematic for cancer risk and also cancer progression. And so this here shows this, wine glasses these days, you can pour, sometimes 3/4 of a bottle of wine into 1 glass. And so that's not what we're talking about. These are the old school glasses that are very small. And so I think it's really important for people to monitor that. There are great alcohol alternatives out there. And so this is just something to pay attention to. So now back to the topic about dietary supplements for prevention. We know that dietary supplements are very popularly used in the United States. And again, we do not have any good data suggesting that they're actually protective against cancer or for improving cancer survival. There are a couple of very large studies that were run, some of them here out of the Hutch, showing, testing selenium and vitamin E for prostate cancer prevention. Those weren't effective. Beta-Carotene for lung cancer prevention actually showed that beta-carotene supplements increase the risk of lung cancer. And this was after coming out of data looking at the dietary patterns of people. And we saw that if people were eating these foods, that it was protective against cancer. And people said, oh, well, just take the components in the food and stick it in a pill. And that doesn't work. And so that's why we're so focused on trying to get people to incorporate some of these fruits and vegetables into their daily dietary patterns. Now, one thing that I wanted to point out here is that we do have some new data coming out, not in clinical trials. This is really more animal-based research and some in vitro lab studies showing that chondroitin sulfate may increase melanoma risk. And so a lot of people take glucosamine and chondroitin for joint pain. Costco sells a lot of this. And so if you're interested in, if you're using that for joint pain, or if you know people are, we suggest just focusing on glucosamine there. Or acupuncture is very useful for joint pain, then you don't have to take supplements at all. So I want to talk a little bit about the trials that we've been conducting. And so this is one of the first trials that Anna and I conducted in New York. This was among Latina breast cancer survivors. And this is where we had our hands-on cooking classes. And so we conducted a 3-month intervention where we brought people in for cooking classes. We taught them about nutrition. We took them food shopping field trips to local green markets and the local grocery store. And what we showed is that our program was helpful in increasing fruits and vegetables intake and also reducing total calories and fat intake after 12 months. And so this is a model that we're interested in testing further. And so what this tells us is that nutrition education, hands-on cooking and shopping classes can lead to sustainable dietary change. And so this is why we're doing some more of this research here now at the Hutch. Now, we have a larger ongoing trial, and again, I moved from New York a couple of years ago, so I'm still have some trials going on there, but we're getting ready to launch some here. We have a trial that we're going to finish data collection by the end of this year, and here we're now, we call it a 2x2 factorial design trial, where we're testing in-person classes versus online text messaging, email-based interventions with the website. Because we know that people like coming to our classes, but it's hard. I mean, for our classes, we ask people to come in, once a week for a month, or once a month for a year. And we know we all have busy lives. And so what we want to test is whether or not having some sort of online platform might be a way for us to not only reach more people, but maybe that's just as effective as having people come in for classes. We don't know. So we currently have a study going on where people come in just for the classes, just receive our online and text messaging communication, or they receive both, or they receive our control. And we're going to see by the beginning of next year, we'll have some information there on what's the most effective. Stay tuned. So in summary, for lifestyle behaviors for cancer survivors, avoid tobacco products, wear sunscreen, achieve and maintain a healthy weight, engage in physical activity, eat lots of vegetables, especially crucifers, eat healthy fats such as olive oil and nuts, avoid junk food, limit alcohol, manage stress, engage in mind-body practices. This is where our integrative medicine program comes in, and don't use dietary supplements for cancer prevention. So I just want to close. I have a few slides on our integrative medicine program at Scca. So we really have 4 components to our program: clinical care, research, education, and guideline development. Our vision is that integrative medicine won't be its own department eventually. It won't be set aside. Eventually, we're going to be incorporated into all aspects of medicine at Scca. Our focus really is on improving quality of life and increasing resiliency from the time of diagnosis through treatment, survivorship, and end of life. We emphasize acupuncture, mind-body therapies, lifestyle behaviors, and counseling on dietary supplements, and we are a highly interdisciplinary group. So just a little bit about our program. We launched last year. We have our team of 4 clinicians. One of the things that's a little unique about us is that we are a billable service where we need to be financially sustainable. We have a shared electronic record with all the other clinicians at Scca. We're co-located within Scca outpatient services, which means that we share a medical record with all the other docs. We can consult with them in the hallway, and it just makes it so we're a truly integrative medicine program. And the work that we're doing serves as a research platform. And then this is my last slide. I mean, really what's the most important is that we all want to work at Scca on working with the patient and for the patient. And so our integrative medicine program is just one piece of the larger pie of how we're supporting our patients. So we have excellent pain, palliative care, psychiatry, social work, spiritual health, physical therapy, nutrition, and survivorship programs so that we're really taking care of the whole patient. So thank you very much.
Great talk, Heather. We've got time for a few questions. Yes.
You said no supplements, but what about things like flaxseed meal, nutritional yeast? They're food, they're not nutritional supplements. Nobody's extracted the lectins, for example. Nobody's extracted anything from the flaxseed meal, but triple banger, it's got.
So we would consider more that a food than a dietary supplement. So it's really if you're eating the flaxseed as part of your diet, that's one thing. If you're taking it in pill form, that's different. Yeah. So
Things like soy, where we know that there is specific breast cancer advantage because of the phytosterols.
So soy is part of the regular diet in moderation. We think is fine. But sometimes people are taking really concentrated soy tablets or capsules that we don't have data suggesting that they're effective.
I teach my students to make sure they have soy in their diet. So many of them think that estrogens are bad things, and phytoestrogens are in fact a benefit for breast cancer.
We think that we think that they're beneficial. We actually don't have strong data though suggesting that they're that protective in clinical trials. So there's some observational data that suggests that, but we don't have clinical trial data showing that at this point.
Dr. Greger's website for this?
I don't know who Dr. Greger is. No.
Nutritionfacts.org, one of the most useful clinical.
Yeah, I'm familiar with that organization. I can look at that again. But I just know from the clinical trials, so we're interested in looking at large-scale clinical trials with disease endpoints, not just changing biomarkers. And so we still don't have the definitive trial on soy at this point. But I think incorporating soy in the diet can be really useful. But we're concerned about people who are taking it as in dietary supplement form. Great.
Multivitamins?
We like things like one a day that have very, sort of standard dosages. Some multivitamins out there have really high dosages of some of the compounds, and so we think that could be problematic. But something like a one a day or the Centrum is fine. That's our general recommendation for most patients.
Do you have any data on juicing?
So juicing is interesting. So juicing, it depends on the kind of juicer. A lot of juicers extract all of the fiber. And so what that ends up doing is spiking people's blood sugar. And so and even if you juice and you grind up all of the fiber, it still can spike the blood sugar because it's not digested as slowly as if you eat a whole piece of fruit. So we actually recommend, our nutrition group here recommends eating whole fruit or whole vegetables instead of juicing. That's the general recommendation.
Here.
Okay.
And then here.
Is there a certain group of patients that should plug into this program in a sense that you are working with?
We want to see everybody.
You do?
Yeah, we do. We do. We think everybody can benefit from it because, a lot of these are just lifestyle behaviors that may or may not be related to cancer specifically, but we're all human beings. Most people have some level of stress or have some form of their diet or physical activity that can be improved. So we're happy to see everybody.
So how does one do that? Is that something that we sit down with you or somebody?
How does it work? Right. So our program here at Scca is open to Scca patients, and so you can make an appointment with us. We're a consult service, and so they either get referred from the oncology team or people can self-refer as well. And so our referral information is out on this flyer.
How about somebody from outside whose provider wants to send them to you?
So we don't see outside patients at this point. We don't have enough staff to do that, but we do. There are other people in town who are doing some of this work as well. Actually, there is a survivorship clinic. I take that back. So there is the Cca Survivorship Clinic, and so I think people. Yep.
Yes.
You're welcome.
Do you have an opinion about acupuncture in the community acupuncture model model versus one-on-one model?
So I love the community acupuncture model because it provides acupuncture to more people and it's lower cost, and I like that. And it's actually much more similar to the way acupuncture is actually practiced in China. The problem with community acupuncture is a lot of those providers aren't trained in oncology. And so that's one of the reasons that we put together this flyer, which is what to ask your community acupuncturists to see whether or not they're appropriate. But in general, we love that model. And we would love to do group classes here. We just need SCCA to build a new building for us, so we have a big enough room. So,
And we are building. a new
yeah,
building.
right. We're working on that. Yeah.
To what extent may acupuncture modulate the immune system?
That's a really good question. There are some studies suggesting that it does change immune parameters, but we don't really know what that means long-term for health benefits. But we know that it can do something to the immune system. So there's some interesting work happening there.
David, do you have a question? David, did you have a question?
Yeah, I did. So my ophthalmologist is sort of a miniature mad scientist. And what he has been suggesting to me is that the United States government a few years ago made a decision to reduce the amount of iodine in people's diets, and that there's a huge distinction in cancer rates, including melanoma rates, between countries that have done that, like the United States, and a country like Japan, where there's still a fair amount of iodine in the diet. Do you think any of that at all?
I've heard a little bit about that, but I can't make any statement about that. I don't know. But I think looking at the epidemiologic data will be really important, and then ultimately running some trials to see if that makes a difference.
Question right here, yes.
I heard at one time that melatonin can be helpful for melanoma.
I don't know about that, so I can't really say specifically. I do know that melatonin can be helpful, very helpful for sleep, and so we do recommend that for patients for sleep. The dosages that are generally recommended are somewhere between 2 and 10 milligrams. Some patients come in taking much higher doses, which can make them really groggy in the morning. So we use it more for symptom management than we do for treating or preventing a specific cancer.
So Heather, I love the way you said that you don't plan to turn this service into a department. You want to blend it into all the services. I'm trying to think in surgery, how can we blend surgery?
Oh, we
That
can
gonna
do.
work.
No, we can do it.
No, I'm talking about the other way around.
Yeah. Oh,
I'm not
with
going to put
us.
surgery into all the other
Yeah.
departments.
No, but we
I think
can
just think that-
infiltrate.
I know that philosophy, I think it's just wonderful. And
Yeah.
financially, I'm not sure well that's going to work for you, but I love that,
Yeah.
that concept. Question?
Yes, I'm wondering for your clinic, how's the insurance or?
Yeah, so Washington State is actually a really interesting place to run this sort of program. So in 1993, the Washington State Insurance Commissioner mandated that health insurance programs or plans cover naturopathic medicine, acupuncture, chiropractic care, and massage. Now there's some loopholes to that. Medicare doesn't do that. And so
So if you have a supplement or something like that, it's not going to cover?
usually not, but sometimes they do. And so our team has become expert at understanding which plans do and do not cover these things.
So would a person, like if they had several cancers, had heart, could it be possible that Medicare would take care of
It's possible. It really depends on the individual plan.
calling you?
So the way for our service, the way it works is you call and you call and talk to our schedulers, and they ask about what plan you are, and then they go and they talk to our financial services people in the back end to help understand, so that patients understand what's covered and what's not covered before they come for a visit.
Great.
Okay, so you have brochures out at the
Yes.
table that people can pick up for
Yep.
more information. Perfect. You can tell there are a lot of questions, a lot of interest.
Thank you all
Thank
so
very
much. Thank you.
Let's get you hooked up here, David. From the top of your shirt, actually. Yeah. Okay. You said Microsoft.
Yeah, or you can just use name too. It's fine.
So thanks you all for staying. I see very few people have left, which is good because it means you value end of our day as much as I do. The patient, for those of you who've come to this many years, you'll know that the patient stories is what this is all about, really. We have science and survivorship, but it's really about patient stories, the connectedness we have as human beings, the fact that there's uncertainty with every step we take every day, that we don't know it until we take a step and it's a very different direction. And the fact that people are willing to share their stories with melanoma, to me, is the most important part of what we offer here. And so we have a volunteer this year. We have 2 volunteers. And by the way, I mentioned this morning that if you were willing to tell your story, I'd love to hear from you. I've had 2 people come up to me, but I would love to have 1 or 2 more. So please let me know if you'd be willing to share your story in the future. But I think when I talk to volunteers to share their story, as you probably recall, David, I don't say you need to do this. I say what really works is to tell your story with your heart, and it'll always work. So some people have slides, some people have music, some people have just voice, some people have spouses up, and your story is your story, but they all add together to be incredibly valuable. So with that preface, that thing bounces around a little bit, as Heather knows. Our first storyteller today volunteered his services, and happy to introduce David Howard. So David is an attorney at Microsoft, and he's been through quite a journey, as you're going to hear about. He has a blog that I'm sure he'll share where how to find that as well. And we're just delighted to hear you speak. Thanks, David.
Thank you. Thank you, David. So I guess a couple of preliminaries for me. First of all, I want to thank the speakers who've gone so far because, you know, these are people who are incredibly skilled and competent and very deep in what they do, and somehow they have managed to talk in a way that I actually understand 80% of it. And that is actually quite a skill, and that's so I want to first of all begin by thanking everybody who has spoken up until now. The second preliminary is I just want to say I'm nervous, and you know I know it's not I'm not nervous because I'm not used to public speaking, because I do a fair amount of public speaking. I've talked to juries, I've talked to courts, I've talked to boards, but usually when I give a speech, it's from my head, and this is a very different one because today I'm really going to try at least to speak from my heart. So, my name is David Howard, and I have stage 4 melanoma. And you'll see up there that I've written my name in a way that sort of suggests that I'm spelling it. And for those of you who go regularly to the infusion center at Scca, you'll understand what I mean, because there's a little bit of a ritual that we all go through. I lie prone in a hospital bed or in a recliner with 2 nurses there, checking the pole that is next to me against the computer that is nearby. And I repeat my name and how to spell my name. And of course, that number that has become all too familiar to me, 320-3393. That's me. And you know, the one thing I will say about that is pretty remarkable is that even though that number is me, when I'm at Scca getting treatment, I never feel like a number. As I said, I have stage 4 melanoma. I've been having immunotherapy treatments at Scca for just about a year. And I'm pleased to say that so far the results have been good. The tumors, thank you. The tumor, I heard somebody clapping. The tumor in the original site, which is my rectal area, has reduced. The tumor in my metastasis on my liver has also reduced substantially, and I'm doing well. And I'm so grateful to Dr. Thompson and his staff, and the nurses and PAs and people who do the blood draw, and people at the infusion center, not only for their skill and the wisdom that they show every time that I'm here, but also for their humanity. It really is a special place to come. And I wish I didn't have to, but them's the breaks. I want to start by telling you a little bit about myself. I'm from Philadelphia. I moved here 9 years ago with my family to take a job at Microsoft, as Dr. Bird said. That's a picture of me back in Philadelphia. I was much, much younger then. And those two people with me are actually my parents. And that was actually a very special day. And it's a day that I'll never forget because it was their 40th anniversary. And in some ways, it's a day that I'll never forget, not because it was a day to commemorate, but because of something that happened that day. There was a moment during all of the festivities when I choked up. I started to tear up and cry. And I walked away from the crowd that was all enjoying themselves. And my mother saw this, and she was a very intuitive person. And she came and she walked up to me. She put her arm around me and she said, "Don't worry, Dad and I are going to be around for a long time." Well, that wasn't to be the case. In a year, she had breast cancer, and a year later, it had killed her, and I watched her die. And 6 years after that, my father contracted bladder cancer. And a year after that, watching his physical and mental decline, I saw him die. And so from those moments on, perhaps the biggest fear in my life was that I too would end up with cancer. And then it happened. 8 years ago, a year after I had moved to Seattle, I was having some rectal bleeding. So I went to the doctor and they said, well, it's probably a polyp or a hemorrhoid. And if not, it's probably some early stage colon cancer and we can take care of it. You need to do a colonoscopy, so they did a colonoscopy. This thing isn't really working very well. And the result of the colonoscopy, surprisingly, was that I didn't have a polyp and I didn't have a hemorrhoid and I didn't even have colon cancer. I had melanoma that had started in my rectum. And that was pretty scary. I had what at the time was known as a lower abdominal resection, which means that I had my rectum removed. And I lived with an ostomy for 5 months. But the news from the surgery was actually very promising. This was very early stage melanoma. In fact, it was akin to melanoma in situ. We're guardedly optimistic that you'd be fine. Had the surgery on the East Coast. And I felt pretty good about that until 3 years later during a regular skin check, my dermatologist found, or my proctologist found, a freckle near my anus. And given my history, they decided to remove it. And it too turned out to be melanoma in situ. Not a recurrence, but an original new melanoma. Again, in a place where, as somebody said before, the sun don't shine. Again, it was removed, and again, the prognosis was promising, and then a few years later, it happened again exactly the same way. And then about a year ago, almost exactly a year ago, I had one of my regular colonoscopies, and another mass was found in my colon near where my rectum should be, but no longer is. And it was melanoma, and this time I learned that it had spread to my liver. I came to Scca for treatment, and as I mentioned, that treatment has gone well. But to say that I was filled with fear and anxiety at the time, as you can imagine, and as many of you can imagine because you've been through it, would have been a gross understatement. I was scared to death of dying. I was scared of the type of decline that I had seen my parents endure. I had just separated from my wife not too long ago. I was scared of dying alone. I was scared of dying without loving and being loved in the way that I had hoped, which was a pretty profound fear that I faced at the time. And it was kind of rough. And so I started doing all sorts of things to manage my fear and my anxiety. I got a prescription for Xanax. That didn't help that much. I started smoking a lot more pot. That didn't help much. I tried doing some other stuff that I won't even talk about here. That didn't really help very much. I tried meditation. And usually what happened when I meditated was that I dozed off. But one day that didn't happen. And something really unusual happened. I heard a voice. And I'm not going to suggest to you that it was the voice of God or some other deity. I think it really was coming deep from my subconscious. But what that voice said to me was, "You dumb shit. It's not like that you're going to be able to avoid this forever. Come on." And I thought about that. And it was true, because none of us are going to be able to avoid this forever, avoid confronting our own mortality. It's something that we all have to expect will happen, and well, maybe it would happen a lot sooner than I hoped or expected, but you know, that's the way it goes. And I started thinking a little bit more at that point about my life than about my death. And the question that I kept asking myself at the time was simply this: how can I make whatever time I have left, whether it's 3 months or 30 years, as meaningful as possible? And so that became something that was really a prime focus of what I was trying to achieve. I love this quote from Mary Oliver. I started beginning to think very seriously about this question. What is it that I plan to do with my one wild and precious life? The truth is that the last year or so since I got my diagnosis has been pretty remarkable for a number of different reasons. It's been in some ways the hardest year of my life. It's felt like every pillar of my life on which I had built my life was on quicksand. My health, my relationships, changes in my work. The dog that I rescued even got me kicked out of the apartment that I was living in. I mean, you name it, and it was going wrong. But at the same time, there was something pretty remarkable. In the last year, in a lot of ways, has been the best year of my life. Now, I do want to say this. I'm going to tell you my story, and I'm not going to suggest in any way that it should be the same story as any of you. It's very personal, and it's very personal to me. And I also recognize, and I'm incredibly grateful for a few things that not everybody in this room can say, and not everybody who has the same diagnosis as me can say. One is that I haven't had any pain. I've had some side effects that have occasionally propped up from time to time, and some of them have been worse than others, but for the most part, I felt pretty good, and there have been no limitations on what I've been able to do physically. The other is, I work for a great company that's been incredibly supportive. I have incredible health insurance that has paid for everything that I've had to go through. And I have resources beyond that that have allowed me to do things and live my life in a certain way. And I'm very, very mindful of the fact that not everybody is able to say those things. But I do think that whether you are a melanoma patient or not in this room today, this question that I asked, what is it that you plan to do with your one wild and precious life, is a question that everybody can ask of themselves, and should. So this is a linocut, and it is a representation, an interpretation of a tarot card. It's called, this particular piece of art is called David's Moon, and the artist who made it is in the room today. And it is a very special piece of art that was created for me. It's based on the tarot card called the Moon. And it shows, as you can see, a lobster, wearing its shell, of course, climbing from the depths of some body of water and facing the magic and mystery of the dark. And it's special to me because I am that lobster. When I was a kid, I wanted to be a superhero. I was rewarded for being really good in school, for never getting angry, for never being sad. And so I created this persona around myself of this person who was effectively a superhero and who had all of those qualities. And, the problem with creating this suit of armor that I was wearing, or this shell, was that maybe it protected me at times from getting hurt, but at the same time, it also prevented me from feeling things. And so as I faced this crisis over the course of the last year or so, I came to realize that I could no longer wear a shell, and that it was time for me to emerge from the depths in which I was sort of at the bottom of some body of metaphorical water, and to emerge into my future. And I realized that the way that I needed to do that was by becoming a more vulnerable person and a more authentic person. To actually be willing to speak my truths. And that started with one person who I spoke with and told my truths to and who didn't judge me. And that felt pretty good, so I started speaking to other people and being more open with them. And then I realized that there was another step that I needed to take. And that was to share my journey more broadly. So I started a blog, and the blog is about finding meaning in your life while living with cancer. And initially, I just had a small number of people who were able to see the blog. And then I realized, well, why am I doing that? Because maybe it could help other people. So I opened it up more broadly and even started letting people know on certain melanoma Facebook support pages, which if you haven't checked out, you might want to do about it. And at this point, I've been writing it for almost a year. And I've published about 25 different chapters. And it's gone from being just kind of something that I thought would be an interesting exercise to something that, frankly, has become one of the main purposes of my life. Being able to share myself and being authentic about who I am and the things that are happening to me has been hugely rewarding. And it's been rewarding in a couple of senses. Boy, this thing is really not great. It's been rewarding in the sense that it's been an antidote to me for the life that I had led, where I had covered myself in this armor or this shell. But the other thing that I've realized, and in some ways it's one of the themes of this talk, is that when I really was vulnerable with people, when I really did open up, something really special happened. People started being vulnerable with me. It doesn't always work out. When you take off that shell and you open yourselves up, sometimes you open yourself up to being hurt more, and that definitely happened. But it was also worth the price. I had one friend who confessed to me that he had been suffering for a long time from mental illness. I had another friend who talked to me about her daughter's substance abuse and own mental illness. And recently I had a friend who I had known since I was 12 years old, who commented on one of my chapters and told me for the first time something that he had shared with virtually nobody in his life, which was that his father had sexually abused him for 8 years. Encouraging people to open up and being able to see people and have them see you, and realizing that when you let people see you, they let you see them has just been an extraordinarily rewarding experience. All of this also made me think a little bit about work and how I viewed work in my life. And as David said before, I work for Microsoft, and I'm very grateful to the company in so many ways. But I realized some things about work and the role that work had had, and that's that, I let work define me for many years. My dad worked for a department store in Philadelphia. He worked 6 days a week and took maybe 2 weeks off a year, if that. And so, the idea of this incredible work ethic, working all the time, after dinner, on weekends, all of that stuff, just became like a very much an important part of my life. And I also realized that work was something that allowed me to detach from the rest of my life. It was a great excuse. And when I started having my problems and when I had my diagnosis and started thinking a little bit about this subject of vulnerability, I realized a few things. One is, cancer made me a better boss. I was more empathetic to the people that I worked with, one of whom is sitting here right now, crying. And I became a better boss because I was a more authentic boss. When I screwed something, I lost that air of infallibility. If I screwed something up, I admitted that I screwed it up. If I didn't know the answer, I admitted that I didn't know the answer. And then there was the day that I shared with my team my diagnosis. And I brought them all into a conference room, and I told them exactly what had happened to me. And I told them I was scared, and I told them I didn't know what the outcome would be. And we all shared a good cry, and we all shared hugs. And I realized as they all marched out of the room afterwards that something very special was going on. I had always wanted their respect and admiration, but I had earned their love, and that was so much more important and so much more special. I also realized that it was okay to say, I don't want to work as hard, that there are other things in my life that I want to do with it. And so I stepped down from my position at the company, and I'm working part-time there now, and I'm writing, and hope to write more, and I hope to open a coffee shop in the next few months, and do other things that I want to do with my life. I went traveling. I spent a month in Europe. I visited my daughter who lives in Copenhagen. I went to France, I went to Switzerland, I went to Portugal. This particular picture is from Portugal. And I did it mostly by myself, and I recognized how much power and freedom and vitality I felt from doing what I wanted when I wanted. And so I came back with a bit of a manifesto, which is to live my life not contingent on other people, not deferential to other people, but in a way that really pleased me. That's been an important lesson for me over the course of the last several months. This guy got that memo. It's not me. He's another guy that I saw in Portugal. And I will admit that I wanted to show this slide because I think it's funny, but I thought it was also illustrative of the point. So I got back from Europe and I kept walking because I find that walking is a manifestation of my freedom and my power. I went hiking in the Canadian Rockies. I went to the Grand Canyon. And as I sat with my legs dangling over the canyon, I had another epiphany. And that was that I wanted to, as I looked out over this huge expanse, I realized that what I wanted to do was to live a huge life. And what does that mean? It means living a life without artificial limitations, without the narrative in your head telling you why you can't do things that are really self-imposed limitations. I wanted to ask why I couldn't do those things and really think about whether the limitation was real or whether it was not. I wanted to live an authentic life. That is one in which I was doing things for myself and not being deferential or dependent on others unnecessarily. And I wanted to live life with an open heart, see the beauty in every moment, and to see the potential meeting in every encounter. And so to try to find some connection with whoever I was dealing with, whether it was a good friend, or whether it was a colleague, or whether it was a banker, or whether it was a barista. There's an opportunity for connection in every engagement. And so I thought a lot about this quote when I read it. It's from Carlos Castaneda. And what it really means, I think, is that I wouldn't trade the position that I'm in now for, I mean, if you could tell me that I could be cancer-free tomorrow and wouldn't have to come to SCCA, absolutely, I'm all in. But that's not a choice. And given that, maybe there's a way to see disease as an opportunity. And maybe, you know, when you can see your own death, and it's a little bit closer to you than it was before, what you realize is that you really don't have time to waste. And there really is an opportunity, no matter how much time you have left, to live your life in the way that you always wanted to live your life. There are a lot of people that are important to me. And what I realized, as I said before, is that if you really see people, they will see you back. I think I mentioned that at one time I was worried about loving and being loved in a certain way. And I realized a couple of things. One is that that's not how you can measure your happiness. If your happiness is dependent on other people, then you're never going to get to the point that you need to be in life. But the other was that there were a lot of people out there who loved me, and maybe in different ways, maybe in a variety of different ways. But the support I felt from all of those people, including my kids and others, was extraordinary. So I want to just take a moment to recognize them. This is my friend who sent me a picture of Ryan Gosling when I said I needed a picture of him. All of this doesn't mean that I've kicked the problem of fear and that it's behind me. I do have moments where I feel like I'm making progress, and then I have weeks like this last one where I had to go in for some special medical test that thankfully turned out okay, where I am afraid again and have all of the same fears as before. But I would say this, I've learned a few things. I found a quote recently from Seneca, who was a Stoic philosopher. And he said, "The one who puts the finishing touches on their lives each day is never short of time." And that's pretty meaningful. The Stoics believed that if you contemplate your own demise, rather than bringing fear, it will ultimately bring peace of mind. And I think that there's a lot of truth to that. And then back to David's moon, I've thought a lot about the darkness. And what I've realized is the destination of this journey that I'm on, where I want to go, is actually to get to the point where I can accept the darkness, where I can accept the unknown, where I can accept its beauty where I can accept its magic, where I can accept its certainty, and where ultimately I can accept my death, regardless of when it may take place. And the other thing that I've learned is that in those moments when I am living that huge life, doesn't happen all the time, I still have a very, very long way to go. But when I can live an open-hearted life and an authentic life and a life that's not dictated by self-imposed limitations, I am not afraid. So my daughter, my younger daughter, called me a few months ago and she said, "Dad, how would the new David feel about me getting a tattoo?" And what you probably remembered was that the old David had told her that if she got a tattoo, he would disinherit her. Only kidding, but sort of. And I said, "Look, Emma, you do whatever you want. I don't really care anymore. Do what your heart tells you to do." And by the way, I'm thinking of getting one too, which shocked her just a little bit. But a few weeks ago, I did, and I chose to get this. It's a cancer support ribbon. And it's not filled in because different types of cancers, have impacted my life. And I got it for a few different reasons. I got it to remind me that I'm still standing. After 7 surgeries, having a temporary ostomy, countless doctor's appointments and colonoscopies and sigmoidoscopies and CAT scans and PET scans and immunotherapy and side effects and bleeding, I'm still standing. I got it to remind me, whenever I look down at it, of the person I want to be and the life that I want to lead. And I got it to remind me not to care about what other people think, to be my own person and to live my own life. And so we're going to end today with a communal exercise. And I apologize in advance if I offend anybody. I told the little girl who was sitting here to get out. But here's what we're going to do. We're all going to give the finger to melanoma. And on the count of 3, we're going to do that, and we're going to say, "Fuck cancer." All right? So here we go. 1, 2, 3. Fuck cancer. Thank you very much.
Well, that was remarkable, David. Just, by the way, any person coming up and tell their story. Sorry?
I see. How are you going to follow him?
No. That's what I was going to say is anyone who chooses to tell their story, don't put the bar anywhere in particular. From your heart is what counts. So, David, thank you so much. That was spectacular. I don't think I've ever heard a room say the F word collectively. And I don't know if our mayor is here yet, but if she walked in that door and saw that, she'd either join us or she'd turn around. I don't know which. Anyway, we have some logistics going on. Thank you so much. I'd love to actually have you up here for a lot of questions. So the logistics are, we have the mayor and her team here or very close to here. We have some media here, and Q13 is here as well. They need a little setup time, so we're going to take about a 10 to 15 minute break, and then we're going to have a fireside chat with Mayor Jennie Durkin. David, thank you so much. So thanks, everybody. I haven't seen this room get this quiet this fast, ever. Thanks, everybody, for staying around and for understanding the break. And David, I didn't want to shut your time short there because it's a very powerful story we just heard from David. I did tell Mayor Durkin about what we did as a room just before she walked in, and I'm not sure how she would have responded to that. So it's my honor and pleasure and privilege to introduce your mayor, our mayor, Jennie Durkin, who has volunteered to come join us in this symposium. And her diagnosis was public information, so I'm not breaking HIPAA violation unless I give any details, which I won't. But the fact that she not only heard about the symposium, but said, I'd like to be part of that. And I think there was a component of gratefulness and pay it forward, that to hear from one of our leaders at an extremely busy time in Seattle's life just humbled me, and so I was delighted. It also means this is on September 7, because this is one of the few days where we knew that she would very likely be available. So we usually have, on our patient stories, we don't necessarily have a closer, but I think this is about as much of a closer as we can get. So we decided to do it a little bit differently and have sort of a fireside chat format and a little bit of a kind of a town hall component. So I think both she and I would love to hear you ask her questions about her experience, maybe share your experience with her. I hope it's understood by everybody. This has nothing to do with government politics, our city challenges or opportunities.
Although I do get the middle finger there too.
Right, so she's seen that one before. But it's really trying to focus on why we're here today. And I told her the same thing that I told David and other storytellers. If you speak from the heart, don't worry about the head. Everybody will really, this will resonate with everybody in the room. Most of the people in this room have either been directly touched by melanoma or are continuing to be touched by melanoma, and touch in the biggest fist sound of the word. So I thought what I would do is just maybe give a very short intro line and then let Mayor Durkin tell components of her story that she chooses, and then see how we open up with questions and answers. We have perhaps up to an hour, depending on your schedule. But if you get whisked out of here, we understand. There is some media in the room, which we welcome as well. So I'll just start with I'll make a statement first. I will tell you that this woman is a very good patient. And you know what I mean? She follows directions and she asks, what
Please don't tell my staff that.
Staff, go away. She said, what do I need to do? Where do you want me to be? And I said, well, first of all, we'll get you in here whenever your schedule works. You can come in the side door over on East Lake. Next thing I know, she's in the waiting room, sitting there patiently waiting for her turn. She followed some pretty strict immobilization instructions, and I think that's how she had to give her diagnosis away, because everybody kept talking about her knee. Very well, and I just want to see she walks the talk as a patient, so that's what my statement on that. But I think I'll just start this off. And I thought I have a fairly busy schedule. I don't have a busy schedule. This woman has a busy schedule. And this hit right around the time of the viaduct. There were 3 or 4 major things in Seattle, and she gets a new diagnosis. So I guess my question for you is, with all of that going on and this entered your life, how did you hear that and what did you do about it?
So first, thanks for having me, Dr. Bird, and thanks for everyone who's here. And let me just say my hats off are to everyone in this audience. I know what it means to get this diagnosis. Can I get just a quick show of hands? How many people are the patients here? Right, and how many people are loved ones, supporters? Right, okay. So first, a little background, and I'll get to that. So I consider myself one of the luckiest people on the planet because I was born a redhead. And it had great upside, fiery temperament, determination, never stubborn. But when I went to Dr. Bird after diagnosis, and he's going through and he goes, did you ever have sunburns to the point of blistering as a child? And I'm like, every summer, many times a summer. So I grew up with a cognizance that I would have, skin issues, and I've had basal cell carcinoma, excised many times. I had checkups regularly. And so when I discovered a spot that I wasn't quite sure what it was, I went into my dermatologist and said, hey, can we just biopsy that? But then kind of left my mind. So I was right in the middle of a really busy time in Seattle, as the doctor said. It was, we were called it the Seattle Squeeze. Our viaduct was coming down and was going to close. And because of that, we had to reroute thousands of cars, and we only have so many streets that go north-south. We had to get people on transit. So we had a big push on that. And right in the middle of that, I had to go, the U.S. Conference of Mayors meets every January in Washington, D.C. And I was the vice chair of one of the committees there, and was literally my wheelie bag in my hand going out to the car when my phone rings. And it was my dermatologist popped up, and I thought, that's not good. So she told me the diagnosis. She said, look, your biopsy came back. It's melanoma. She told me the type. She said, you need to get in to see someone right away. And I think everyone in this room, whether you're the person who's the patient or whether you're the loved one who hears it the first time, it's like time just stops and the world telescopes into that moment. And it just, everything goes through your mind at once. Fear, anger, anxiety, what does it mean? A million questions, can't be me. And so for me, that was the same thing. It was just in that moment was suddenly, okay, this is different and this is real. I think all of us will agree that we're both blessed and cursed by the internet. Because like every good medical consumer, as soon as she called me, I made the calls to see if I could get into the oncologist, find out what kind of surgery I had to have. And then I went online. I shouldn't have. We do it every time, we still do it, because it was, color me of course I got a kind that was a little more rare. You almost wouldn't have seen it. It was amelanotic. So, I knew all the signs of melanoma. I looked for them carefully. This one didn't have those signs because it didn't have the melanin. It was also nodular. So, so it was just like a little wart. So it was like, I was so lucky that I was able to get it. But like everyone in this room, you fear the worst. You start reading the research and you just start, suddenly your present seems like it could also be your future. And you don't know how much beyond that you have or what's going to happen. And I think for me, the hardest part was that uncertainty. The time between getting that phone call to having the surgery was pretty rapid, to getting the final results back to see what stage it was and whether it spread. I was very fortunate because we caught it early. If you go on the internet or if any of you have that kind of melanoma, the stats aren't good. And it was either going to be about a 40% survival rate after chemo and radiation, or it was going to be about a 90 to 98% survival rate after surgery. I think I had a good surgeon. And we did the lymph node biopsy, and when I got those results back, when he called me with that, it was like a fog had lifted. But then you still cycle through it because you're never quite sure. You go for your 3-month and your 6-month. So I think that all of us know that it is in many ways, you process it as an individual, but you are protected by those people who love you around you, and I think we forget how hard it is on them because they immediately fall into a support role. And they don't want to show any of their fear or anxiety because they want to support you. And for me, my partner and I decided, we have 2 sons, and we live a very kind of public life more than they would like ever. And so it was a real question for us as to when did we tell them? Because given the range of probable outcomes, we didn't want to tell them too soon because we wanted to know more. Because they would go to the darkest, hardest place. But at the same time, that also meant that I had to be not as forthcoming as I would have been with the public, because I would not let the public know more than I would let my own children know. And so we really had to struggle with that kind of, it's hard for a mayor to just kind of disappear. People notice when you're not around. And so the doctor was really good. We had surgery, I think, on a Wednesday or a Thursday. At the end of January this year, and the first snow started Sunday. And the doctor said, well, we recommend that you take at least 2 weeks, but we think, to be safe, 3 weeks. Well, 6 days after surgery, I'm on the phone because a snowstorm is there, and then the big one hit the Thursday following that. And then I started morning press calls and conferences, meeting with my team downtown in front of the cameras, big knee brace in place, At that point, you obviously had to be honest about what was happening. We had the diagnosis so we could tell our kids, and so that made it easier. And it also, as the doctor said, for me, it was, I think, a really important thing to show how cancer can touch any life, anytime. Any life, anytime. And that how we deal with it is one of the few things we can control. We can't control the diagnosis. We can't necessarily control what the care is going to be, but we can try to control how do we live our outward life? And what do we do for the people around us? What do we do to say there's nothing shameful in having cancer? There's nothing has to be secret in having cancer. And more people, and melanoma is one of those cancers I think people don't think about very much. And so I was really, and I felt that it was not just a good thing to do, but really an obligation to be able to step forward. Now I'm going to shame someone right here walking down these stairs, is my younger brother, Tim Durkin. And 6-7 months before I was diagnosed with my cancer, he was diagnosed with cancer, CCL, and went through chemotherapy. And so we had lived through that. He had beat it, he was good, and then I got my diagnosis. So I also want to give him a big round of applause. So that was just like everyone in this room, whether it was you or your loved one, it's just that immediate, like telescoping to the moment, thinking, what does this mean? Trying to get as much information as you can. None of the information seemed very hopeful. Trying to grasp to those reeds of hope that you can, and cycling through the fear and the anger and the anxiety and the hope. But I hope that where we end up, because there's been so much progress made, is that we can actually, the leading edge can be hope. Because we are really making such remarkable progress, particularly in this region, but it only helps with the patients who are willing to be part of it.
Great comments. So a couple questions just come to mind. One is, I think you are at least in control of how you interact with your day. You're told to go places, but you have an element of control as leader of the city to some extent. And this one, you don't have any control at all, as everybody in this room knows. So how did you reconcile that I don't have control over this, and yet I would in any other circumstance?
That's a great question. I think in some ways that was, for me personally, a huge relief, because largely because my brother went through it, but I have other friends who've gone through treatment. The first thing you got to do is get the right medical team in place and the right support services, and then you got to trust them. And I felt I had the right one in place, and so in some ways it was a huge relief to be able to say, okay, you got this, tell me when I need to worry more. Now, of course, you keep worrying. But I think that was the first thing that is a hard thing, is to give up that control, but you're giving up control not just for me, who's able to, in my daily life, be able to have a lot of impact on decisions regularly, but you're also realizing that your ability to impact into the future is so limited by whatever the diagnosis and the treatment are. And that's a hard thing to do.
So I told her that this is not a shy room. I know I'm correct in that.
No middle fingers yet.
That was just one individual got us to all do that. How about some questions from the audience? We've got the mayor here for a very special time and some questions. You're not shy. I know you're not shy. There's one there in the right in front of you.
I'm just curious if you experienced what a lot of people tend to think that melanoma is no big deal. Oh, it's just skin cancer. And I wondered if you heard a lot of that. And being the leader of a big city like this, is there anything that cities can do, counties can do to spread the word that this is a very serious thing? It's fatal.
I think that's a really, really observant point, because people, when they think cancer, they don't think melanoma. And so even people, when they hear the diagnosis, they go, oh. And they literally do that, like, oh. So I think it's really, the public information campaign is really important. Because I think even people like me who'd had skin cancers before, I did not have a significant enough appreciation for how dangerous melanoma was until I got the call. And then when I went online and started looking at it, I was like, okay. So I think you're right. I think that public information, not just in the prevention side, but in the how deadly the cancer is, and how, that even I, who am fortunate enough to be, survivor, is what's the return rate and what is the continued risk rate? Because the risk doesn't go away because you beat the one cancer, and you can look at my skin and know my history, and I now have this question mark in the back of my head all the time.
Yeah, a disease is obviously the great leveler, but do you think you were treated any differently as a celebrity? And whether that says anything about our medical system?
So I will say that I think that I had the advantage of being connected in with really good doctors, and that I was able probably to get seen by my doc and have my surgery quicker than some people would. Part of that is I already had access to really good health care, and so I think that was having those connections into the doctors was really an advantage. I mean, I tell you, the one thing this also pointed up to me was how important health care is, and that it is the difference between life and death for people. And for me, I not only had really good health care coverage, I already had really good primary care doctor and people who, and a good dermatologist that I saw regularly, so they had that connections in. But as the doctor said when they said I could visit, to me it was really important to be in that waiting room. And I will tell you, it was one of the most inspiring moments. The first time I went to see the doctor after the surgery, no, it was before the surgery, and I was in the waiting room. Every age of person, every race of person, every configuration of family sitting in that waiting room. And we were all the same. And everybody had the same combinations of fears and anxieties and hopes. And for me, that was an enormously connective moment with humanity. And I felt so fortunate to be able to be a person in that waiting room and have access to the great health care that we have here.
So I'll make a comment on that as well. And Nancy Davidson in the back, who's the CEO of the Scca, who happens to be in the back of the room, will know this as well. We have a lot of patients who come through who are, quote, VIPs. And when I get a call from the dean of the medical school, I know one thing: get the person in to be seen. So I think there is clearly a path of getting in quickly in a celebrity or a VIP. But to me, it's incredibly important, treat the person the same with your medical decision-making and your surgery, the same. And there's a saying in surgery, the enemy of good is better. Sometimes good is good. And I think there are people, maybe some not quite as gray a hair as mine, who try to do things a little different in their practice of their medicine. I think it's critically important, treat people the same. But if I don't get somebody in pretty quickly, I'm going to hear from Nancy, I'm going to hear from Fred Applebaum, there's going to be so many phone calls, and my staff, Jennifer, my nurse is in the audience here, will get all these phone calls. So that access is, I think, is a pathway that works best for the celebrity patient, but treating them the same is important. The bigger issue, I think, is the healthcare access, and this is not our topic today, but I'm a big believer that it should be a right, not a privilege. And we don't do well as a nation with that, and we need to do better with that. But I think that's my take. Thank you.
The other thing I would say is, our family, I come from a big Irish Catholic family, 8 kids. My father had a lengthy illness for a period of time, and we learned then that advocacy is really important in healthcare. And I will say that having a good advocate is better than being a celebrity or VIP. And we learned quickly that sometimes if the doctors didn't have time, you just went and sat in the waiting room. And so I think having that ability to, the one thing the internet's bad because it scares you, but it gives you information and access, and then I think just good, strong advocacy, and at every step of this way, because we know that, doctors get busy and the healthcare system is sometimes unimpenetrable. I mean, you're just not sure what door to go in. And so having that support system and a good, strong advocate, I think is probably one of the most important things you can have when you reach a really important healthcare moment.
Great question. By the way, this is our Dr. Anna Bars of OHSU. She's a speaker for
I'm
this morning.
from a rival city, Portland.
We call that our southern suburb.
Thank you so much for sharing your experience with us all. And I was wondering, because I talked earlier about a public health campaign that we're launching in Oregon called The War on Melanoma. And we're getting some new advertising images. We're doing a huge push on media, social media, in print, on radio to advertise melanoma as a skin cancer that you can spot with your eyes. That's kind of our slogan. And we'll be measuring and doing studies to see if that public health campaign has any impact on Oregonians who happen to have one of the highest incidence of melanoma in the whole US, second only to Utah. And we'll probably be using states that don't have any public health campaign as a control state, so to see if our campaign has made any difference, if melanomas are caught earlier. And I was wondering if you'd be able, if you were thinking of using your experience, not just in a campaign and let Seattle people know, but maybe something on a statewide basis. Is there anything that you're planning on doing in the legislature or on a statewide basis that could possibly alert more people to melanoma?
I'm open to any suggestion. One of the reasons I came here today was to learn what are those areas where I can help. And in big things and small things. I mean, we were, I'm not supposed to insert city business, but I will just for a second. We just sold a big piece of property the city of Seattle owned very near to here. And we got a tremendous amount of money for it, a lot of public benefits, affordable housing, community center. But one of the things for me that was so inspiring is it's a company that is known for building, healthcare and bio companies. And so I think I'm willing to be part of any campaign on melanoma or any other cancer if there's a polycancer campaign, because it is, as we know, time is life. When you are able to discover it can often decide, both your treatment and prognosis. And so when we live in somewhere like Seattle where we have a lot more sun than we think we do. And people get exposed not thinking that they do and don't know what to look for. And both the prevention side and the diagnosis side, I think we need a lot more public information. So sign me up.
Question? I saw hands.
It's soft, I'm just gonna. Hi. So I would imagine that you're probably somebody who has a lot of your sense of identity from your career, among other things. And I was wondering about how much this diagnosis was sort of a tricky thing to incorporate in that sense of who you are in the world.
That's actually a really good question, because one of the things, at least for me, is when it came is for different people, there's going to be different reactions. But the more I read about kind of prognosis, it seemed to me there was door number 1 and door number 2. And door number 1 clearly meant that if it was that door, I wasn't going to be mayor anymore. I was going to take 100% of my focus. I was going to focus on my kids and my family. And there's door number 2. So you just are kind of waiting on that. And then you have just, the limitations that you don't think about before. The mobility issue that Dr. Bird mentioned. My knee was completely mobilized for 9 weeks, 8 weeks, something. I mean, and I now can do most of it, but for example, I took the big splurge last week and bought an electric bike because I find I just can't ride a bike the way I could anymore. That's just going to, so there's a whole range of things. But on career, absolutely, because I think it goes back to you're so kind of focused on moving forward and getting things done, and suddenly there's a disruptor that you have no control over whatsoever. And it could mean that your life is going to change in every single way. And for me, I think I talked to my partner a little bit, and you try not to talk about the prognosis because you're going to only hope for, the good door. But it was pretty clear to me that that it had not been, it was going to require my whole focus on beating the disease. But the good news is it really prioritizes you really quickly. So I will say that was very enlightening for me.
So while people are getting brave enough to raise their hands up, so regarding support systems, I met Dana, your wonderful partner. I saw her with you, I think, every time. Your brother's here. He clearly has true support, both from having been there and your brother. But you've got staff and others who are supporting you in a very different way. So how did you walk through that field of the personal support for you and this disease with the rest of your support? If that question makes sense.
It does, and I think there's a lot of facets to it. First, I will say is I was not a perfect patient when I was out of your sight. And despite the very clear instructions on, don't even think about contacting the office for X period of time, a couple of things happened in the city that required me to have a phone call with my office right after surgery and being released, and I do not recommend it to anyone. I don't really remember that call. My staff does, and I think I wasn't very nice. So you forget, again, I just want to say, even now in retrospect, I'm just realizing how much impact it has on the people around you who are supporting you in all sorts of ways, but they have those same anxieties and fears because their relationship with you, and for my office, obviously, their jobs are so intersectional with what I'm doing. And so they're there, they're worried about you, they're fearful, but it also impacts their lives on a daily basis. So I will be honest, it's tough to navigate because part of being a leader is you don't want to have people, you're supposed to take care of people. And you're supposed to not show weakness is the American myth, or you're going to have a very clear direction. And so having to, for people to wonder suddenly, what does it mean for me in a very real way, beyond your family? And then it's, because it is a public job and because there did end up being some public reporting on it, you run into complete strangers who ask you about it. And so you have to kind of be ready to peel back that level of privacy as well, which is another challenge.
Dr. Davis.
You mentioned the impact that cancer has on the family. I was curious about what you're willing to share about how it went with your sons.
It's really interesting you should say that. So we made the decision not to tell them until we knew more. And then once the pathology came back from the biopsy, the sentinel node biopsy, and the diagnosis was better, then we talked to them. They now say, because we just had another conversation about that, we totally underplayed it. And until they overheard us talking with someone else, they didn't realize how bad it was. And that could be a little bit of mama bear thing. I will admit maybe we didn't really, tell them all. And it was interesting because I just took my youngest son to college and we were out and we were talking about it. And they're like, you never really talked to us about it. We just had to hear you talking to other people. Now, I thought we had, but it just tells you it's like everything else in life. Sometimes it's not one big conversation, it's 100 little conversations. And I think that's a really important thing to remember is that you may feel you've had those conversations with people, but people hear things differently and they hear it when they're ready. And it sometimes requires those multiple conversations because also you get more comfortable yourself in sharing your anxiety or your fears or the reality. So I think it's really important to kind of realize that it's a process too.
That concept of waiting until you have more information to really share is a really solid principle because you don't know, again, which door you're headed through. There's a fair amount of research with small children. Now, your kids are not small, or young, I should say.
Dependent, but not small.
Yeah. I know that too. So what's known is that small kids handle the truth better than adults. They don't handle the unknown well. Their imaginations will take things way worse than reality, and their antennae about what's going on with parents is very good. And they can tell by nonverbal and verbal cues what a level of anxiety or fear is. So the best research says, be upfront with your kids, always tell the truth with hope. Those two fundamentals. And then the second part is, when you get asked a question, doesn't matter when it is, drop what you're doing, look them in the face, and answer with truth and hope. And that works great with small kids. Again, with adults could probably learn a lot from small kids. But it also means being aware of when that question comes up. Again, you sound like some of this dialogue came up later. And that's, even with adult kids, that's a good time just to stop and say, well, let's talk more about that. So I think that's
great advice.
questions.
That's right in the back.
Okay. That's a throwable microphone.
I could, yeah,
We can throw it.
I can,
These are really lightweight. So if
we'll,
you
we'll,
haven't had these before, they
group
work in
effort.
conference rooms pretty well. Look how gentle they are passing.
So
It's like
when
hot
you-
potato.
That's right. So when you decided that you had to make it public, how did you keep it from dominating the conversation and getting back to city business?
That's a really great question. Part of that is I really did have a really great team around me, a communications team, and we consciously thought about, okay, what's the best way to do this? And it kind of goes to the other question, though. Once it was public, in some ways, because I'd already been through the surgery, had the diagnosis, was out there physically in the public, and then it's just melanoma, I think it didn't dominate as much as it would have. So I think that, we consciously waited to tell anyone until I knew more. And then once I was going to be in public and it was clear that I was out of the office for surgery, and then I was in public with this, not being able to bend my leg. Other than that, I looked awesome. No, right. And really, there was so much going on in the city at the time that it kind of took care of itself that way.
I forgot, it was Snowmageddon. That was.
Snowmageddon.
Questions?
I do have one. You're such a busy lady and have so many responsibilities. Can you share with us, or do you want to share with us, mentally and emotionally, how you handle that when you are, in a certain amount of control and busy and whatever? How did you handle that?
That's right. Did everyone hear the question back there? The question was basically, you're so busy, but how do you handle the emotional part of it at the same time that you're having to perform in public and get all this stuff done? It's hard. I will tell you, it's really hard. I think it's one of the hardest parts in my job, period, is navigating those, being as rational and reasonable as possible all the time. But when you are going through something that is so personal, and you are so scared and so mad and so uncertain about what the outcome is, and then to have a public face on it, I think it was a difficult thing to navigate. And I think but that was just me in a very public setting. I would guess that every single one of you patients have that too, just in a different way. You want to be strong for your husband or your kids. You want it for your mom or your family, for your friends, for your coworkers. We're cultured to not show emotions and to be stoic. And so I think one of the things that is probably, and I don't know what the data shows on this, but I think a healthier response is, how do you let yourself show those emotions? Because they're there. And if you don't, they're going to come out somewhere else. And so how do you really trust yourself and trust the people around you enough that you can show those fears, and you can cry, and you can be mad. You can give the middle finger many times a day. And at the same time, be a good person and be a person who's responsible, and be whatever role you're in, you're still good at that and can still suffer all these really kind of painful, difficult emotions.
Yeah, if you don't have a pity party, you're not going to do well. It doesn't have to be a public pity party, but to have that, why me, this shouldn't have happened, and that's important to let that emotion out at some point. And the same thing with the anger part. This is not fair, I didn't deserve this, I live a healthy lifestyle. But if it doesn't come out somewhere, it will come out later, and sometimes in health issues. Yes, sir.
Yeah, as a caregiver, she was a nurse and was a caregiver for life. I find it frustrating as a caregiver that sometimes it doesn't seem, and I'm going to ask you directly how your partner, can you accept help, and how do you accept help graciously without getting angry?
Let's take that one.
Yeah. So, it was, taking the help was easy for me. It was at least at home. I think probably not outside the home. There I felt like I had to have a much stronger front and what are you nodding your head at? That was my brother. And so I think that it's a human dynamic. It's hard to accept help. And for some of us, it's harder, particularly those who are the caretakers or the moms or the people who are supposed to think of ourselves as we take care of people. But again, it's one of those, there is no bigger leveler than sitting in that waiting room. And that's a metaphorical waiting room too, knowing that, you are tied to every other human, and it doesn't matter how you got there, you're there. And I think that's the process as you go through it. When you realize that if you don't have that support system, I'm not sure you can buoy on those oceans, because it just can be overwhelming at times. And I think even after you're through the surgery and the recovery and you have the label survivor, you're still not there. The fatigue is still there. The worries are still there. Is it coming back still there? Every time I go to my dermatologist now, I've taken up my ballpoint pen and I have circled, anything that might even look like anything. And on my body, that's really bad. But and you just, because it just stops you in your tracks when you hear those words. And you're not quite ever comfortable thinking you can start in your tracks again.
Other questions?
I'll ask again. Having faced door number 1 and door number 2, does this change your future at all? Does it make you decide, maybe I want to do something else besides, this high-octane job in Seattle?
I think it is for me. It's continues to be kind of defining in terms of making the most of every day, and I don't know whether I've been able to process it through what does that mean for the longer term, but it does really impact how I view the ability to be more intentional and try to be, get more done. I think it's been a lot harder in many ways on the people I work with, because I'm more impatient than ever. Because I just feel like you got to get it done, and I know that there's, I've talked to other people who've had cancer, and there's that same sense of whatever they happen to do, that's what comes out, is I don't know how long I got, so I'm going to get it done. And so that sense of impatience, I've had to dial myself back. I'm not very good at that. And so I think that it is, but it's also made me much more hopeful, and also to tap into those things that are hopeful. For example, one of the things the city of Seattle did that I think is so remarkable is we voted to tax ourselves again, to have more preschool, better programs K through 12, and free college for kids. And my great coworkers and staff that I work with know now if I've got a really bad week, I can tell it's going to be a really bad week because suddenly on my schedule will be children. And I'll be going to a preschool, or they'll be coming here, or I'll be with high school kids. And being able to have those kinds of programs built into who we are as a society that actually provides that longer-term hope, for me, is more important than ever before. And I find myself driven to make sure that we at least deliver on that. We can't, we've got to give, I agree with Dr. Bird, healthcare is a human right. It shouldn't be just for the few. Every person should have access to good healthcare. We should make disease a part of the past. We will cure cancer, and we will do it here in Seattle. Everyone should clap at that. But we shouldn't limit our hope to the narrow field of cancer. We should be pushing for hope in every part of life so every kid growing up in Seattle and America has access to opportunity, good health care, and could be the one sitting here, maybe not as a survivor, but as the doctor. Yeah.
Yeah.
Don't want to leave anybody out, but also we don't have to go the full hour, so I respect you. I'm sure you have things you can do.
Not that anyone has anything to do on a Saturday.
Any other?
Impatience? How many are impatient? Yeah.
So let me just say, number one, we live in a great city. You
Best city anywhere.
are a great leader of a great city, and thank you for being our mayor. And it's really a privilege to have you come to this and you share a personal part of you that is not easy, and it's a very different part of your job, and we're very grateful for that. So thank you for coming.
Thank you very much. And I just really want to thank Seattle Cancer Care Alliance for all they do for so many people. Being in that waiting room was not only, a leveler, but the level of care from the minute you walked into the door, the first face, the friendly face, to the doctors, and to the Hutch here, who's really driving the engine of the research. I feel really lucky that I got this disease in Seattle. Really lucky.
Thank you.
Thanks. Everyone go enjoy your day.
Thank you. So just only housekeeping, fill out your evaluations. Please put down suggestions for next symposium. Have a great weekend.